One of my concerns is our general insufficient infrastructure to do all the things that we've talked about. In addition to the obvious taking care of patients, we have testing, distribution of vaccines. Do we have sufficient healthcare workers, protective gear, syringes, data monitoring system, manufacturing capability, transportation, storage, all of those things? Do we have enough to actually pull this off?
Well, you know, the challenge is what's enough, right? When I think about PPE, if we have a huge surge, we're not going to have enough. For the current number of cases we have enough. But the issue is, can we keep the cases there? You know, and the same thing happens with testing. When you were saying testing was getting behind and was taking 10 to 14 days, in great part it was because we had a surge in cases and all of a sudden we had to do so many tests. So you never have, you always build the infrastructure for what you need, but you can't predict the future, right? If all of a sudden right now you had a huge surge, I mean, I'm thinking about our colleagues in India, for example, and how India is having close to 100,000 cases, new cases per day. There's no way to keep up. There's no way to have enough PPE or testing or anything to get over that. I mean, they really are in a very difficult situation. The way cases are right now in New York City, for example, in which they're having less than 3 cases per 100,000 population, they have plenty of testing, plenty of PPE, they're doing just fine. So part of the challenge that we've had with not having a national strategy in our country is that you wish you could move those things around, right? New York has too much, we need to move it to North Dakota because they're having a problem right now. And the ability to do that logistics, I think, would have been a really key role of the federal government in this pandemic, or to say, you know, North Dakota really needs testing right now. We're gonna take those swabs and send them to Massachusetts where they have too much testing capability. And that logistics is really what you need to see happen. The reality is that we are in a point in this pandemic where we're planning for the future is incredibly hard. And again, I think what we need to rely on and what we need to encourage is what always gets us out of trouble, which is innovation, right? Is discovery and innovation. And I think there are a couple of things that have worked really well in this pandemic, I think. And one of them is scientific discovery, is research has worked incredibly well and has given us vaccines and treatments and other things. So we need discovery and innovation to help us get out of this. And I've seen a lot of innovation happen in PPE, for example. I've seen people come up with face shields and with all sorts of things that we never had any idea before. And I think we need investment in better masks, in better face shields, in better PPE that people can then use in a more effective way. And so I think it's not just using what we have, but doing more of what we need.